Hello and welcome to Learning English Pro. My name is Jer, your online English teacher and guide. Today's Medical English Masterclass for Doctors has been carefully tailored with doctors in mind. I've selected a series of lessons from my YouTube channel specifically to help medical professionals like you communicate more effectively in English, whether you're diagnosing patients, prescribing medications, or discussing surgical procedures. This masterclass covers all the essential phrases and vocabulary you need in your daily practice. I've organized the lessons into 5 key topics: patient care and diagnosing, medications and treatments, surgery and emergency care, diseases and disorders, and a final section on healthcare professionals. To navigate the lesson more easily, I've included timestamps for all the individual lessons, so if you want to study a specific topic or skip ahead, you can do that in the video description. For all of you asking for PDF guides, you're in luck. For this lesson, I've created the English for Doctors Masterclass PDF guide. It is a comprehensive resource designed to accompany this lesson. The guide contains all the essential vocabulary, phrases, and definitions from each lesson, organized by topic to help you navigate key areas of medical English with ease. This guide is 100% free for all my viewers, and you can download your copy with the link in the video description. So let's get started with today's masterclass. The first lesson is English phrases for diagnosing patients. On your PDF guide, open page 4. You're very welcome to today's lesson, where we'll be focusing on key phrases and questions doctors use when diagnosing patients. This lesson is designed to help you conduct professional and clear medical consultations in English. For this lesson on patient diagnosis, I'll be taking you through some key English questions and phrases that doctors use when diagnosing their patients. By the end of this lesson, you'll know how to ask the right questions and gather crucial information about your patient's symptoms and medical history in English. Let's get started. It's key to understand the diagnosis process. As a doctor, gathering the right information is critical to making a diagnosis. The questions you should ask should cover several areas. The chief complaint: what is bothering the patient the most? The onset: when the symptoms started. The severity: how serious the symptoms are. And the history: any previous medical issues or treatments. Now that we've broken down the diagnosis process, let's dive into some key phrases that you can use to ask your patients the right questions. First, you need to understand the patient's main problem. These phrases will help you ask about their chief complaint. What brings you in today? This is a simple way to ask what the patient's main issue is. Can you describe your symptoms? This is a common phrase to get the patient to talk more about their condition. What seems to be the problem? This is another way to ask about the patient's main concern. How long have you had these symptoms? You can say this when you want to understand the timeline of the patient's symptoms. When did you first notice this? This is a great follow-up to pinpoint the onset of the problem. These questions help you get to the heart of the patient's problem, so you can start narrowing down potential diagnoses. Next, it's important to gather more information about when the symptoms began and how long they've lasted. Here are some useful phrases. When did the symptoms start? This is a direct way to ask when the patient first experienced the issue. Did the symptoms come on suddenly, or have they developed over time? This helps determine whether the issue is active or chronic. Has the pain been constant or does it come and go? Understanding the pattern of the symptoms is essential for diagnosis. Has it gotten worse over time? Useful for tracking the progression of the problem. Are the symptoms better or worse at certain times of the day? This phrase helps identify triggers or patterns. Knowing when and how symptoms began gives you a clearer picture of what might be causing the patient's condition. If the patient is in pain, it's important to assess the severity. These phrases will help you understand how serious the pain or discomfort is. On a scale of 1 to 10, how would you rate your pain? This is a common way to get a numerical assessment of pain levels. Is the pain sharp, dull, or throbbing? This helps to understand the type of pain the patient is experiencing. Does the pain spread or radiate to other parts of your body? This is useful for identifying conditions that affect more than one area. What makes the pain better or worse? This question helps determine if any activities or medications affect the symptoms. Have you taken anything for the pain? Has it helped? It's important to know if the patient has already tried treatments and what the results were. Assessing the severity and type of pain is crucial for diagnosing conditions accurately and recommending the right treatment. Understanding a patient's medical history and lifestyle is also critical to diagnosing their condition. Here are some key questions to ask. Do you have any pre-existing medical conditions? This question helps identifying underlying health issues that could be related to the current symptoms. Are you currently taking any medication? Knowing what medications the patient is on helps avoid drug interactions and can explain certain symptoms. Have you had any recent surgeries or treatments? Past procedures can provide clues to the current issue. Do you smoke or drink alcohol? Lifestyle factors can impact health significantly, and this question helps identify potential risk factors. Has anyone in your family had a similar condition? Family history is important, especially in cases of hereditary conditions. Getting a full picture of the patient's medical history and lifestyle ensures you don't miss any important details in your diagnosis. Once you've gathered all the necessary information, it's time to wrap up the consultation. Here are some phrases to close the conversation professionally. Based on what you've told me, I'd like to run some tests to get a clearer picture. This phrase signals the next step in the diagnostic process. I'm going to refer you to a specialist for further evaluation. If you think the patient needs additional care, this phrase is useful. Let's schedule a follow-up appointment to monitor your condition. It's important to ensure ongoing care by arranging a follow-up. Please let me know if your symptoms change or get worse. This encourages the patient to keep you informed of any developments. Thank you for coming in today. We'll stay in touch with your results. This is a polite and professional way to close the appointment. Ending the consultation in a clear and professional manner helps maintain patient trust and ensures they know the next steps. And that's it for today's lesson on diagnosing patients in English. I hope these key phrases and tips help you feel more confident during your medical consultations. Don't forget to download your free PDF guide, which includes all the key phrases and a glossary of medical terms we've covered today. You'll find the link in the video description, so make sure to grab your copy. Also, stay tuned because I have a whole series of lessons coming up for doctors. The next lesson in the lineup is 50 Essential Phrases for Doctors, covering useful phrases for a variety of medical situations. If you're a doctor working in an English-speaking environment or studying medical English, this video is for you. Today, I'll be covering essential English phrases that doctors use in daily interactions with patients. These phrases will help you build confidence and communicate more effectively in a medical setting. If this is your first time with Learning English Pro, make sure to subscribe to stay updated on all my latest lessons. As a doctor, the first impression you make is crucial. Here are some common phrases doctors use to greet and introduce themselves. Hello, I'm Dr. Smith, and I'll be your doctor today. This phrase sets a professional tone and establishes your role. How are you feeling today? A polite and simple way to check in on the patient's well-being. Please take a seat and let's talk about how I can help you. This phrase invites the patient to sit down and signals you are ready to listen. These simple phrases help put patients at ease and make them feel comfortable talking about their health concerns. Now let's look at some useful phrases for gathering important medical information from your patient. Can you tell me about your symptoms? This is a general question to begin understanding the patient's condition. When did the symptoms start? This phrase will help you determine the timeline of the illness. Have you experienced anything like this before? Checking about past experiences can help identify patterns. Are you currently taking any medication? Asking this question ensures you're aware of any treatments or medicines the patient is using. These questions are essential to creating an accurate diagnosis. Always listen carefully to your patient's responses as they'll guide you to the next steps in treatment. Once you've assessed the patient's condition, the next step is to explain your diagnosis clearly and professionally. Based on your symptoms and test results, it seems like you have the flu. It's best to start by naming the condition in simple terms. This is a common condition that we can manage with the right treatment. This statement will reassure the patient if the condition is treatable. I'd like to order some further tests just to be sure. This explains the need for more tests, keeping the patient informed. Here are some treatment options we can discuss. With this statement, you can introduce treatment possibilities and involve the patient in decision-making. Clarity is key here. Use simple language and avoid overly technical terms unless you're sure the patient understands them. Doctors often need to provide instructions or recommendations. Here's how to phrase them effectively. I'm going to prescribe you some medication to help with your symptoms. This is a straightforward way to inform the patient about medication. Please take this medicine twice a day after meals. This is how we can give specific instructions for how to take a medication. Make sure to follow up with me in a week to see how you're feeling. We would say this to encourage follow-up care and monitoring. You should get plenty of rest and drink lots of fluids. This, of course, is common advice for recovery. These phrases help ensure that your patients know exactly what they need to do to improve their health. It's important to reassure patients and help them feel at ease, especially if they're anxious or unsure about their condition. You're in good hands and we'll do everything we can to help you recover. Saying this offers reassurance and trust. This is a treatable condition and we're going to take good care of you. This statement emphasizes the positive outlook. Don't worry, we'll monitor your progress closely. Saying this ensures the patient knows you'll keep track of their condition. A few kind words can go a long way in helping patients feel more relaxed during their treatment. I hope you enjoyed these essential phrases for doctors working in an English-speaking environment. By using these, you can communicate more clearly with your patients and ensure they understand every step of their treatment. In this lesson, you will learn 100 English phrases for patient care. This is great for nurses and other healthcare workers. In this lesson, we will explore key phrases and techniques that are essential for providing excellent patient care. We'll cover a range of topics, including morning activities, bathing and bathroom, toilet assistance, emotional support, encouraging mobility and exercise, communication with family, and transitioning care. Each section will provide you with practical sentences and tips to improve your communication and caregiving skills. By mastering these key phrases, you'll be better equipped to create a positive and supportive environment for your patients. So if you're ready, let's get started and make a difference in the lives of our patients with compassionate and effective care. Our first topic is morning activities. Good morning, how are you today? Good morning, how are you today? Hello, I'm Jer, your nurse for today. Hello, I'm Jer, your nurse for today. Hi there, nice to see you again. Hi there, nice to see you again. How did you sleep last night? How did you sleep last night? I hope you had a restful night. I hope you had a restful night. Would you like help getting dressed? Would you like help getting dressed? What would you like to wear today? What would you like to wear today? Let's get you into some fresh clothes. Let's get you into some fresh clothes. Can I assist you with your shoes? Can I assist you with your shoes? Do you need help with your buttons? Do you need help with your buttons? Let's move on to our next topic, which are phrases for bathing and the bathroom. Would you like a bath now? Would you like a bath now? I'll help you get to the bathroom. I'll help you get to the bathroom. Do you need assistance with your bath? Do you need assistance with your bath? Let's get you freshened up. Let's get you freshened up. I'll help you with your hygiene needs. I'll help you with your hygiene needs. Is the water temperature okay? Is the water temperature okay? Do you need help getting in or out of the tub? Do you need help getting in or out of the tub? Would you prefer a shower instead? Would you prefer a shower instead? I'll assist you with washing. I'll assist you with washing. Let's make sure you're comfortable and clean. Let's make sure you're comfortable and clean. Next up, we have some English phrases you might use to help a patient to use the toilet. Do you need to use the bathroom? Do you need to use the bathroom? I can help you get to the toilet. I can help you get to the toilet. Let's take a trip to the bathroom. Let's take a trip to the bathroom. Do you need assistance with your clothing? Do you need assistance with your clothing? I'll be here if you need help. I'll be here if you need help. Would you like some privacy while you use the toilet? Would you like some privacy while you use the toilet? I'll help you wash your hands afterward. I'll help you wash your hands afterward. Let's make sure you're comfortable on the toilet. Let's make sure you're comfortable on the toilet. Do you need help getting up? Do you need help getting up? I'll assist you back to your bed or chair. I'll assist you back to your bed or chair. Well done, you're doing great. You've already learned 30 English phrases. Next up, we have English phrases relating to giving medication to a patient. It's time for your medication. It's time for your medication. Have you taken this medication before? Have you taken this medication before? Do you have any allergies? Do you have any allergies? Let's take your pills with some water. Let's take your pills with some water. This is your medication for today. You could add in the name of the medication here. This is your aspirin for today. I'll check on you after you take your meds. I'll check on you after you take your meds. Let me explain what this is for. Let me explain what this is for. Please let me know if you feel any side effects. Please let me know if you feel any side effects. Remember to take this with food. Remember to take this with food. Do you need a reminder for your next dose? Do you need a reminder for your next dose? Our next topic is phrases related to meals and feeding. It's time for breakfast. It's time for lunch. It's time for dinner. Can I help you with your meal? Can I help you with your meal? What would you like to eat today? What would you like to eat today? Do you have any dietary restrictions? Do you have any dietary restrictions? Let's make sure you're getting enough nutrients. Let's make sure you're getting enough nutrients. Would you like some water or juice? Would you like some water or juice? Are you enjoying your meal? Are you enjoying your meal? Can I help you with your utensils? Can I help you with your utensils? Let me know if you need more to eat. Let me know if you need more to eat. I'll check back in a bit to see how you're doing. I'll check back in a bit to see how you're doing. Our next topic covers phrases related to helping patients with their feelings, emotional support. How are you feeling today? How are you feeling today? Would you like to talk about anything? Would you like to talk about anything? I'm here to listen if you need to talk. I'm here to listen if you need to talk. It's okay to feel the way you do. It's okay to feel the way you do. How can I make things better for you? How can I make things better for you? You're doing a great job. You're doing a great job. Let me know if you need some quiet time. Let me know if you need some quiet time. Would you like to speak with a counselor? Would you like to speak with a counselor? I'm here to support you. I'm here to support you. Take your time. I'm here for you. Take your time. I'm here for you. These phrases are going to be very useful to any nurse or healthcare worker. Next up, let's take a look at some conversation starters. These phrases are really useful when you want to get to know your patient a bit better. What's your favorite book? What's your favorite book? Do you enjoy any hobbies? Do you enjoy any hobbies? Tell me about your family. Tell me about your family. What kind of music do you like? What kind of music do you like? Have you travelled much? Have you travelled much? What's your favourite movie? What's your favourite movie? Do you have any pets? Do you have any pets? What was your profession? What was your profession? Tell me about your childhood. Tell me about your childhood. Do you have any favourite recipes? Do you have any favourite recipes? We are certainly working our way through our 100 English phrases for patient care. Our next topic is encouraging mobility and exercise. Let's go for a short walk. Let's go for a short walk. Would you like to do some stretches? Would you like to do some stretches? It's important to stay active. It's important to stay active. Can I help you with some exercises? Can I help you with some exercises? How about a walk around the hall? How about a walk around the hall? Let's do some gentle movements. Let's do some gentle movements. Do you feel up to some physical activity? Do you feel up to some physical activity? I'll assist you with your exercises. I'll assist you with your exercises. Let's work on your strength and mobility. Let's work on your strength and mobility. We can take it slow and steady. We can take it slow and steady. Our ninth topic is communication with family. Would you like to call your family? Would you like to call your family? Can I help you video chat with your loved ones? Can I help you video chat with your loved ones? Do you want me to update your family on your condition? Do you want me to update your family on your condition? Is there a family member you'd like to speak with? Is there a family member you'd like to speak with? I can assist with arranging a visit. I can assist with arranging a visit. Let's keep your family informed. Let's keep your family informed. Would you like to write a letter or email? Would you like to write a letter or email? I can help you send a message. I can help you send a message. Is there anything you want me to tell your family? Is there anything you want me to tell your family? I'll make sure your family knows how you're doing. I'll make sure your family knows how you're doing. And now we are at our final topic. In this segment, we'll learn phrases for communicating about the end of our shift and transitioning care to another nurse or healthcare worker. My shift is ending soon. My shift is ending soon. I'll introduce you to the next nurse. I'll introduce you to the next nurse. Is there anything you need before I go? Is there anything you need before I go? I've informed the next nurse about your needs. I've informed the next nurse about your needs. I hope you have a restful night. I hope you have a restful night. I'll be back to check on you tomorrow. I'll be back to check on you tomorrow. Thank you for allowing me to care for you. Thank you for allowing me to care for you. I'll make sure the next nurse knows your preferences. I'll make sure the next nurse knows your preferences. Please let the night nurse know if you need anything. Please let the night nurse know if you need anything. It's been a pleasure taking care of you. It's been a pleasure taking care of you. Well done, you've just learned 100 English phrases for nurses and healthcare workers for patient care. You've done a fantastic job. Hello and welcome to Learning English Pro. In today's lesson, we will explore essential medical examination terminology. Understanding these words is crucial for effective communication in healthcare settings. If you're ready, let's get started. Our first term is physical examination. This is a thorough assessment of a patient's body to evaluate their overall health. Physical examinations involve checking vital signs, palpating for abnormalities, and visually inspecting the body. Blood pressure measurement is the measurement of the force of blood against the walls of the arteries. Blood pressure is typically recorded as systolic or diastolic pressure in millimeters of mercury. An X-ray is a diagnostic imaging technique that uses electromagnetic radiation to create images of the internal structures of the body. X-rays are commonly used to visualize bones and detect abnormalities in the lungs and other organs. Ultrasound is a non-invasive imaging technique that uses high-frequency sound waves to create real-time images of internal organs. Ultrasounds are often used during pregnancy to monitor fetal development and for abdominal and pelvic examinations. MRI, or magnetic resonance imaging, is a medical imaging technique that uses strong magnetic fields and radio waves to generate detailed images of the body's internal structures. MRIs provide high-resolution images of soft tissues like the brain, spinal cord, and joints. An ECG, or electrocardiogram, is a test that records the electrical activity of the heart over time. These are crucial tests in diagnosing heart conditions by displaying the heart's rhythm and identifying irregularities. The next few terms involve blood and internal examinations. A blood test is a laboratory analysis of a blood sample to assess for various health markers. Blood tests can reveal information about blood cell counts, cholesterol levels, and the presence of infections or diseases. Endoscopy is a procedure that uses a flexible tube with a camera to examine the interior of organs or body cavities. Endoscopies are commonly performed to inspect the gastrointestinal tract, throat, or bladder. A biopsy is a medical procedure involving the removal of a small sample of tissues or cells from a patient's body for examination under a microscope. Biopsies are performed to diagnose the presence of diseases or conditions such as cancer or infections. Great job, you've just expanded your medical examination vocabulary. These terms are essential for healthcare professionals and anyone interested in understanding the world of medicine. Hello and welcome back to Learning English Pro. I hope you're having a great day. I recently got a subscriber request from Baron Olang asking for an English vocabulary lesson on hospitals. Thank you, Baron Olang. I am very happy to oblige, as this lesson will be a great addition to my playlist on healthcare. First up, let's take a look at some synonyms for the word hospital. We have medical institution, medical facility, health centre, and clinic. Reasons you might go to the hospital include surgery, therapy. You may need to go for testing or an examination. Maybe you need a consultation. A consultation is meeting with an expert, like a specialist medical doctor, in order to seek advice and receive evaluation. If you are a regular patient, you might be going for a checkup. A checkup is an appointment where a disease or illness is monitored. Maybe you are visiting someone in a hospital. In that case, you are called a visitor. Hospitals are divided up into different areas called departments or wards. If you need to find where you're going, you can always ask for help at the help desk or reception. In every ward or department, there will be a nurse's desk where you can seek further information. A lot of people will arrive in hospital because of an emergency. This is a serious, unexpected, and often dangerous situation requiring immediate medical action. And if you have a medical emergency, it's very likely that an ambulance will come to collect you and bring you to the hospital. The person on the ambulance team who initially evaluates you and checks your health is called a paramedic. And if it is required, you'll be put on a stretcher. This is a mobile bed that is used to carry patients to and from an ambulance. Next up, you are on your way to the emergency room. This is what is called in America, and sometimes it's abbreviated to ER. In other countries, it might be referred to as the emergency department or accident and emergency. Short for accident and emergency is A&E. And when you are being treated in the hospital, you are called a patient. If your treatment involves you staying in hospital, you are called an inpatient. And if you stay at home while receiving your treatment, you are an outpatient. And as an outpatient, usually you would come into the hospital by appointment for your treatment. As a newly arrived patient, you will be subject to an assessment or an examination, and this will be done by a doctor. A tool which you'll always see a doctor carrying is the stethoscope. This is primarily used to listen to a patient's heartbeat. Doctors are also known for wearing a white coat, and it is not unusual for them to be referred to as a white coat. They can often be seen wearing scrubs. These are blue or green pajama-like clothing that is worn for protection or during surgery. And during surgery, a doctor can be seen wearing a surgical gown, a face mask, protective goggles, and gloves. A very important employee of the hospital is a nurse. If you'd like to learn more words relating to nursing, check out my video on healthcare vocabulary. Nurses provide care to patients, and a big part of their job is managing the patient chart or patient file. Nurses are known for working very hard and doing lots of different tasks, some of which include taking your blood pressure and your body temperature. And more often than not, it will be a nurse who dispenses your medication to you. Synonyms of medication include medicine or drugs. Let's take a moment to look at the different ways medicine is given to you. One method uses a syringe. This is called injection. Medication can be taken orally with pills. Medication can also be given with an IV drip. This is short for intravenous drip. Common types of medication include painkillers, antibiotics, antiviral drugs, or steroids. In the hospital, you may receive a prescription from your doctor for medication. This is a signed document which you can bring to the pharmacy, and they will provide you with your medication. Next up for our hospital vocabulary, let's look at different types of scans. A scan is a testing method, and these include X-ray, along with MRI, which stands for magnetic resonance imaging. There is also the CT scan. CT stands for computerized topography. There is also the ultrasound, which is commonly used during pregnancy. Another common type of test in the hospital is a blood test. Sometimes it'll be referred to as a blood screening. For some conditions, it may be necessary to stay in hospital for a prolonged period. Sometimes this is done for observation or monitoring. Doctors do this to see how you are recovering or how your condition is progressing. If your condition is very serious, you may need to stay in the intensive care unit. And if you are having difficulty breathing, you may be put on oxygen. For some people, staying in hospital involves having surgery. This can be done for diagnosis, for biopsy, or perhaps for removal or repositioning if something is where it shouldn't be. Or perhaps it's to redirect something like blood flow. And of course, we must consider transplants. There are many other reasons for surgery. Can you think of any more? Let me know in the comments. After surgery, it's very common to get bandaging, and this is done, of course, with bandages. These can also be used for things like sprains or small cuts and abrasions. However, if you break or fracture a bone, you may need a plaster cast. This is done to reset the bone. It can simply be referred to as a cast. I got a cast on my broken arm. If you've broken a leg or have difficulty walking, you may need crutches. For someone who needs additional support while walking, they can use a Zimmer frame. This can also be called a walker. If you are unable to walk, you will need a wheelchair. A wheelchair is also commonly used to transport all patients throughout the hospital. A common reason for women to go to hospital is to give birth. This is often done in the maternity or labour ward. Generally in big cities, there will be a maternity hospital. This type of hospital only takes care of women and their babies. Doctors may also keep you in hospital for convalescence. This means for rest and recovery. This is common after a surgery or after suffering from a serious illness or condition. And when you're ready to leave hospital, the doctor and hospital will discharge you. This is the word we use to describe when the hospital or doctor has given official authorization to release you from medical care and to return to your home. And that brings us to the end of this lesson. You are officially discharged from learning any more hospital vocabulary. But Today we're diving into essential English phrases you might need in a hospital setting. Whether you're traveling, working, or just expanding your vocabulary, this lesson is for you. So let's get started. First, let's cover greetings and basic questions. In a hospital, you might need to ask for help or directions. Someone might ask you, "How can I help you?" We could respond, "Hello, I am looking for the emergency department." Or we could say, "I need to see a doctor." Or maybe you're visiting someone. "I am visiting my aunt. Could you tell me her room number?" Practice these phrases to feel confident in asking for initial assistance. Let's move on to phrases related to describing symptoms. A doctor or a nurse might ask you, "What are your symptoms?" They could also ask you, "How are you feeling?" "I have a headache." "I feel dizzy." "My stomach hurts." Being clear about your symptoms will help medical professionals understand and assist you better. It's also important to understand common responses from medical staff. You may be asked some of the following things. Please fill out this form. Do you have any allergies? Follow me, please. Knowing these phrases helps you follow instructions and respond appropriately. In emergencies, knowing a few key phrases can be crucial. Call a doctor. It's an emergency. I need help immediately. These phrases are vital for urgent situations, so remember them well. And that's a wrap for today's lesson on hospital English. Remember, practicing these phrases can make a huge difference in medical settings. In today's lesson, we're going to take a look at some medicine English vocabulary. This will involve looking at the different types and forms of medicine, along with the associated symptoms. Start this lesson, so grab a pen and paper, sit back, relax, and let's learn some English on medicine together. First up, we're going to explore symptoms in a question format and have a look at the associated medication that is used as treatment for these symptoms. Our first question is, do you have an infection? Do you have an infection? If you have a bacterial infection, you will need an antibiotic. Repeat after me. Antibiotic. Another type of infection that is common is a viral infection, an infection by a virus. And we use antiviral medication to treat a viral infection. Antiviral. Our next question is, do you have pain or fever? Do you have pain or fever? For these symptoms, you would take a painkiller. Repeat after me. Painkiller. Our next question is, do you have a cough? The word cough has an unusual pronunciation. Instead of a G sound, we have an F sound here. Do you have a cough? And the medicine for a cough has a few different names. It can be called cough syrup, cough medicine, or a cough suppressant. My next question to you is, do you have allergies? Do you have allergies? And for an allergy, we take an antihistamine. Repeat after me. Antihistamine. Let's do that one more time. Antihistamine. Our next question is, do you have asthma? Do you have asthma? The type of medicine used for asthma is a steroid. Repeat after me. Steroid. Let's move on to our next question. Do you have a blocked nose? Or we could say, do you have a stuffy nose? If you have this condition, you will need a decongestant. Repeat after me. Decongestant. And a medicine which is in the news a lot lately is related to the coronavirus. And the medicine that is being discussed is a vaccine. Repeat after me. Vaccine. Let's hope that the new vaccine is successful in the battle against coronavirus. In today's video, we're delving into the world of prescription medication. Prescription drugs are a critical part of healthcare, and understanding them is essential for informed decision making. Let's start our video with our main topic, prescription medication. These are medications that require a doctor's prescription for purchase or a doctor's permission. They are often used for treating specific medical conditions, and these types of medications are regulated to ensure safe and effective use. The prescription itself is actually the piece of paper where the doctor's orders are written on. And you're going to take this piece of paper, the prescription, to a pharmacist. This is the healthcare professional who dispenses prescription medications and provides guidance on their use. They play a vital role in patient care and can offer you lots of advice. When you get a prescription, you will also get information and instructions relating to dosage. Dosage refers to the amount and frequency of a medication prescribed by a healthcare provider, so how much you can take and when you can take it. It's crucial to follow the recommended dosage for safe and effective treatment. Side effects are unintended effects of medication, which may happen in addition to its intended effects. So this means that you might feel a bit sick from taking medication. Understanding potential side effects is important for patient safety, and as a patient, if you suffer from any side effects while taking medication, it's important to contact your doctor or your pharmacist. When it comes to picking the type of medication, there are two types. The first we'll look at is generic medication. This is an affordable equivalent to a brand name drug containing the same ingredients. It provides cost-effective options for patients. Now, this term which I've just mentioned, brand name medication, means the original version of a drug developed by a pharmaceutical company. It's often more expensive than generic alternatives. If you are unable for some reason to get prescription medication, you might be able to use over-the-counter medication. This is available without a prescription and can be purchased directly from a pharmacy or a store like a supermarket sometimes. These are typically used for common self-treatable illnesses and ailments. Our next term is drug interactions. These happen when one medication affects the action of another, so these can happen to people who have to take lots of different types of medications. Understanding potential interactions is really crucial to avoid adverse effects. Adverse reactions or adverse effects are unexpected and harmful effects caused by medication. They're like really extreme side effects. They can range from mild to severe and require immediate medical attention. A prescription refill allows patients to obtain additional doses of their prescribed medication. It's essential to follow refill instructions and schedules. Depending on the country, you can sometimes ring your pharmacist for a prescription refill, or you may need to contact your doctor. Next up, we're going to have a look at two different organizations, the FDA in the United States and the MHRA in the United Kingdom. These are drug regulatory authorities responsible for ensuring the safety and effectiveness of prescription drugs. The medication label provides important information about a prescription drug. This can include dosing instructions, side effects, and usage precautions. When you receive your prescription medication, it generally comes with a patient information leaflet. This document offers comprehensive information about the drug, its effects, and safety guidelines. It's a good idea to give it a read over before you take your prescription medication for the first time. Something which will be clearly marked on your medication is its prescription expiration date. This indicates when a prescription medication should no longer be used. It's important to adhere to this date for safety. An important thing to remember for anyone taking prescription medication is medication adherence. This is the practice of taking prescription drugs as directed by a healthcare provider, like a doctor, nurse, or pharmacist, and this helps you to achieve the intended therapeutic effect. Understanding these terms is essential for making informed healthcare decisions when it comes to prescription medication. Guide. Today we're delving into the world of over-the-counter medications, those readily available without a prescription. By the end of this video, you'll be bursting with lots of new English vocabulary. We are going to explore 12 popular medications you can buy over the counter. We're going to learn their pronunciation along with related symptoms, plus lots and lots of synonyms. Also, for every medication type, I will give you 2 phrases and questions for the pharmacy to really help contextualize the terms and boost your conversational skills. Let's dive into the world of self-care and medicine. And first, let's break down the term over-the-counter. This term refers to medications or products that are available for purchase without requiring a prescription from a healthcare professional. These products are typically deemed safe for use without direct supervision by a doctor and are accessible to consumers directly from pharmacies, drugstores, or other retail outlets. Let's move on to our medication types. An analgesic can also be known as a pain reliever and can help with lots of different types of pain, like a headache, toothache, dental pain, or even a backache. Another term for analgesic could be painkiller. Common examples of an analgesic include acetaminophen and ibuprofen. Let's take a look at our example sentences. Hi, I have a headache. Can you recommend an analgesic and advise on dosage? The term dosage or dose relates to the quantity of medicine you need to take for your condition, and this information will also tell you how many times a day you need to take it. Let's move on to our next example sentence. I have some dental pain. Could I get some aspirin, please? Aspirin is a common drug for relieving minor aches, pains, and fevers. People also use it as an anti-inflammatory or a blood thinner. Our next medication type is an antihistamine. Repeat after me. Antihistamine. This type of drug is used to treat allergies, and it can also be referred to as allergy medication. An allergy is where your body reacts to something that's normally harmless, like pollen, dust, nuts, or animal fur. The symptoms can be mild, but for some people, they can be very serious. Examples of antihistamine drugs include loratadine and diphenhydramine. Let's move on to our example sentences. I have seasonal allergies. Which antihistamine do you suggest, and how often should I take it? I am suffering from some hay fever. Can you recommend an antihistamine? Hay fever is an allergic reaction to pollen, usually when it comes into contact with your mouth, nose, eyes, and throat. Pollen is a fine powder that comes from plants. Our next over-the-counter medication is a decongestant. Decongestants relieve nasal congestion. Nasal congestion is more commonly referred to as a stuffy nose or a blocked nose, and the medical term for this condition is rhinitis. Examples of this medication include pseudoephedrine and phenylephrine. I'm congested. Could you recommend a decongestant, and how often should I use it? I have a really stuffy nose. Which decongestant is the best in your opinion? An expectorant helps loosen mucus. A more common term for an expectorant is cough medicine or cough syrup. This medicine helps with a condition known as a chest infection. And mucus is the slippery green substance that can cause congestion in our lungs when we're sick. It can also be referred to as phlegm. Guaifenesin is a common example of an expectorant medication. Let's check out our example sentences. I have a chest infection with a lot of mucus. Which expectorant would you suggest? Hello, I need to get some cough medicine for my son. Which one is best for children? Another medication helped to ease a cough is an antitussive. An antitussive suppresses coughing, so we can also call this medication a cough suppressant. This type of medication is usually given in the form of a syrup, just like the expectorant. A widely used cough suppressant is dextromethorphan. My cough is keeping me up at night. Can you recommend an antitussive, and what's the recommended dosage? I've had a cough for a few days. Do you think I need an expectorant or a suppressant? Antacids neutralize stomach acid, relieving symptoms of indigestion and heartburn. Antacids are available in different forms of medication, such as liquids or chewable tablets. Common examples of antacid include Tums and Malox. I'm experiencing heartburn. Which antacid is effective, and how many tablets can I take at once? I have indigestion. Would you recommend a liquid or chewable tablet antacid? Let's move on to laxatives. Laxatives promote bowel movements and are helpful if one is suffering from constipation. There are lots of different types of laxatives. Common types include stimulants and bulk-forming laxatives. I'm constipated and need a laxative. How long does it usually take to work? Hi, my elderly mother is having trouble with her bowel movements. Is there a laxative you could suggest for an older person? On the opposite side of the scale, we have an antidiarrheal. Antidiarrheals control diarrhea. With the word diarrhea, we have different spellings in American and British English. Diarrhea is when your stools are loose and watery. You may also need to go to the bathroom more often. And for this condition, loperamide is a commonly used antidiarrheal. I have an upset stomach and diarrhea. Can you recommend an antidiarrheal, and how often should I take it? I have had diarrhea for a few days. Can you suggest an antidiarrheal that is fast working and effective? Let's move on to topical analgesic. Topical analgesics relieve pain on the skin or muscles. This type of medication can be referred to as pain-relieving cream or ointment. Examples of topical analgesics include creams or patches containing menthol or lidocaine. Let's check out our example sentences. I have muscle soreness. Would a topical analgesic like a menthol cream? And in this lesson, we'll be delving into the world of the pharmaceutical industry. If you're new to this field, you're in the right place. We'll be exploring 15 essential terms with more detailed definitions to get you started. And let's jump right in. The pharmaceutical industry is a vast sector responsible for researching, developing, manufacturing, and distributing medications that improve human health and well-being. We also have the term pharma, which is a commonly used abbreviation of the word pharmaceutical. This term is often used informally to describe the entire pharmaceutical field and is frequently used in discussions and news related to the industry. Let's take a closer look at this word medication. A medication is a substance used for medical treatment, such as pills, capsules, or syrups. Medications can treat a wide range of conditions, from pain relief to chronic diseases. With this industry, you'll hear a lot about drug discovery. This is the intricate process of identifying and designing new medications through research and experimentation. This includes the initial identification of potential compounds to extensive laboratory testing. Clinical trials are carefully designed experiments to test the safety and efficacy of new drugs before they are approved for use. These trials involve multiple phases and help determine whether a drug is safe and effective. Let's move on to our next bit of terminology, which is prescription drug. A prescription drug is a medication that can only be obtained with a doctor's written order. They are typically used for serious medical conditions and require professional guidance. There is also over-the-counter medication, which is available without a prescription and can be purchased directly from a pharmacy or store. These are generally for common self-treatable ailments. Another type of medication you'll hear about is a vaccine. A vaccine is a substance that stimulates the immune system to protect against specific diseases. Vaccines have been instrumental in preventing and controlling infectious diseases like polio and measles. Drug regulatory authorities are responsible for ensuring the safety and effectiveness of drugs. They review and approve medications before they reach the market. And on screen for you, you can see a selection of these authorities from different English-speaking countries. Probably the most widely known of these would be the FDA in the United States. A pharmaceutical company is an organization that researches, develops, and manufactures medications. These companies range from small research-focused firms to large global corporations. A generic drug is a medication that is equivalent to a brand name drug, but is usually more affordable. They contain the same active ingredients and meet the same quality standards. The term biotechnology involves using living organisms and biological systems to develop new drugs and treatments. This field has led to the creation of therapies like biologic drugs. Clinical data refers to information gathered during clinical trials, helping to assess a drug's effectiveness. It includes data on patient demographics, safety, efficacy, and adverse reactions. Adverse reactions are more commonly known as side effects. These are unintended and often unwanted effects of a medication, which may happen in addition to its intended effects. Understanding potential side effects is crucial for safe medication use. A placebo is a substance with no therapeutic effect. It is used in clinical trials as a control to compare with the effects of the drug being tested. Placebos help researchers assess the true impact of a medication. Pharmacovigilance is the science and activities related to the detection, assessment, understanding, and prevention of adverse effects or any other drug-related issues. It plays a key role in ensuring medication safety even after a drug is on the market. And there you have it, our pharmaceutical industry word list for beginners with expanded definitions. I hope these terms and their detailed explanations help you start your journey in this fascinating field. Today, we're delving into the diverse world of medical procedures, exploring various types of surgeries. Now, a word of warning. In this lesson, you will see scenes of surgeries and human anatomy. Some scenes are not for the squeamish, so please bear that in mind as we embark on our lesson. So let's get started, and this promises to be quite a difficult lesson for English pronunciation, so we're going to take some of the words quite slowly. Laparoscopy is our first type of surgery. This is a minimally invasive surgical procedure that involves making small incisions in the abdomen to insert a camera and specialized tools. This technique allows surgeons to view and operate on internal organs with less trauma and a faster recovery time compared to traditional open surgery. So let's try this word one more time. Laparoscopy. A cholecystectomy is the surgical removal of the gallbladder, commonly performed to treat gallstones or other gallbladder-related conditions. The procedure can be done through traditional open surgery or with laparoscopy. Let's check our pronunciation one more time. Cholecystectomy. Our next surgery type is a bit easier to pronounce. Vascular surgery. This focuses on treating conditions affecting the blood vessels, such as arteries and veins. Surgeons in this field address issues like aneurysms, blockages, and vascular malformations, employing both open and minimally invasive techniques. Vascular surgery. Our next term is appendectomy. This is the surgical removal of the appendix, often necessary when it becomes inflamed or infected, a condition known as appendicitis. This procedure is typically performed urgently to prevent complications. Repeat after me. Appendectomy. A hysterectomy involves the surgical removal of the uterus and sometimes the cervix. This procedure is performed for various reasons, including treating conditions such as uterine cancer, fibroids, or severe endometriosis. Hysterectomy. And our next surgery type is endoscopy. Endoscopy is a diagnostic or therapeutic procedure that uses a flexible tube with a light and camera to visualize the interior of organs or cavities. It is valuable for detecting abnormalities and performing minimally invasive interventions. Endoscopy. A hysteroscopy is a procedure that involves the insertion of a thin, lighted tube into the uterus to examine and treat conditions affecting the uterine lining, such as abnormal bleeding or polyps. Repeat after me. Hysteroscopy. Our next surgery type is gastric bypass surgery. This is a weight loss procedure that involves rerouting the digestive system to create a smaller stomach pouch. This restricts the amount of food intake and promotes weight loss, often recommended for individuals with severe obesity. Gastric bypass surgery. Cataract surgery is a common procedure to remove a cloudy lens from the eye and replace it with an artificial lens. This surgery improves vision and is often performed as an outpatient procedure. Cataract surgery. Let's move on to coronary artery bypass surgery. This is a cardiac procedure that addresses blocked or narrowed coronary arteries. Surgeons use grafts to create new pathways for blood flow, restoring blood supply to the heart muscle. Coronary artery bypass surgery. Did you know I have published a poetry book? It is called Sweet at the Dark and contains lots of beautiful verse for lovers of English. It's also a great way to support my channel, Learning English Pro. It's available on Amazon. The link is in the video description. It's a really good idea for a stocking filler for Christmas or as a gift to a friend who loves English literature. A hip replacement involves replacing a damaged or diseased hip joint with an artificial implant. This surgical intervention is common for individuals experiencing hip arthritis or severe joint damage. Hip replacement. A tonsillectomy is the surgical removal of the tonsils, often performed to address recurrent tonsillitis or other throat-related issues. The procedure is more common in children, but can be performed at any age. Repeat after me. Tonsillectomy. Our next surgical term is a bit tricky. Carotid endarterectomy. This is a surgical procedure to remove plaque or blockages from the carotid arteries, which supply blood to the brain. This helps prevent strokes to improve blood flow. Carotid endarterectomy. A caesarean section or C-section is a surgical delivery method in which a baby is delivered through an incision made in the mother's abdominal and uterine walls. It is performed when a vaginal delivery poses a risk to the mother or baby. Caesarean section or C-section. A breast biopsy is a diagnostic procedure involving the removal of a sample of breast tissue for examination. It helps in determining the presence of cancer or other breast abnormalities. Breast biopsy. Cystoscopy is a procedure that involves using a thin tube with a camera to examine the interior of the bladder and urethra. It aids in diagnosing and treating various urinary tract conditions. Repeat after me. Cystoscopy. Bronchoscopy is a diagnostic procedure that allows the visualization of the airways and lungs using a thin, flexible tube with a light and camera. It is used to detect and treat respiratory conditions. Bronchoscopy. Our next surgical term is probably the longest word I've ever encountered doing Learning English Pro videos. But if you break it down bit by bit, it's actually quite easy to say. Let's try it slowly first. Esophago-gastro-duodenoscopy. Let's do it one more time. Esophago-gastro-duodenoscopy. It can also be shortened to EGD, which is probably a better way to go about it. EGD is a procedure that involves the insertion of a flexible tube into the esophagus, stomach, and duodenum. It is commonly used to diagnose and treat conditions affecting the upper gastrointestinal tract. So let's try that big long word one more time. Esophago-gastro-duodenoscopy. A radical mastectomy is an extensive surgical procedure for breast cancer involving the removal of the entire breast, underlying chest muscles, and lymph nodes. Modern approaches often favor less invasive techniques when appropriate. Radical mastectomy. A vasectomy is a surgical procedure for male sterilization, involving the cutting or sealing of the tubes that carry sperm from the testicles. This results in the prevention of sperm from reaching semen, making a man unable to father children. Vasectomies are a safe and effective method of permanent contraception and are done as an outpatient procedure. Vasectomy. And that wraps up our lesson on different surgery types in English. Understanding these terms and concepts are invaluable for healthcare professionals learning English and for those who have an interest in the topic. Don't forget. Tutor and guide. Today we're delving into crucial English vocabulary relating to medical surgery. This video is really useful for healthcare professionals and for those going for surgery. As this video covers medical surgery, there will be some images and videos of actual surgery, so bear that in mind as you're watching the lesson. So with all of that business out of the way, let's get to it. Our first word is surgeon. A surgeon is a highly skilled medical professional specializing in performing surgical procedures. Surgeons undergo extensive training to acquire the expertise needed to operate on patients, addressing various medical conditions. They play a pivotal role in healthcare, working with precision and care to ensure the best possible outcomes for their patients. Anesthesia is a medical practice involving the administration of medications to induce a reversible loss of sensation or consciousness. It is a crucial aspect of surgery, ensuring that patients remain pain-free and unaware during the procedure. An anesthesiologist is a specialized medical doctor responsible for providing anesthesia and monitoring the patient's vital signs during surgery. They play a critical role in ensuring the patient's safety and comfort throughout the entire surgical process. It's important to note that there are two different types of anesthesia. General anesthesia, which involves inducing a state of controlled unconsciousness in a patient, or local anesthesia. This is a technique used to numb a specific part of the body, allowing the patient to remain conscious during surgery while preventing pain in the targeted area. This is the type of anesthesia you'll get at your dentist. Next up, we have the scalpel. This is a precision surgical instrument with a small sharp blade used by surgeons to make precise incisions during medical procedures. The design of the scalpel allows for controlled and accurate cutting, minimizing tissue damage and facilitating the surgeon's ability to navigate delicate anatomical structures. And the word incision refers to the deliberate cut made with the scalpel to access a specific area of the body during a medical procedure. The size and location of the incision depend on the nature of the surgery, and skilled surgeons take great care to make incisions that promote optimal healing and minimize scarring. The incision site is the specific area on the patient's body where the surgical incision is made. Proper preparation and care are taken to ensure the cleanliness and sterilization of the incision site before surgery, and this helps to prevent infections and promote a smooth healing process. Sutures are stitches or materials used by surgeons to sew the edges of an incision together after a surgical procedure. Suture is also a verb. You can suture a wound. The materials used for a suture vary in composition, and the choice of suture depends on factors such as type of surgery, the location of the incision, and the desired outcome of the wound healing process. Preoperative is a term that refers to the period before surgery when medical professionals conduct assessments, prepare the patient, and provide necessary information about the upcoming procedure. This phase includes obtaining informed consent, which we'll discuss in a moment, conducting medical tests, and ensuring the patient is physically and mentally ready for surgery. Post-operative encompasses the period after surgery, focusing on the patient's recovery and the monitoring of any potential complications. Medical professionals closely observe patients in the post-operative phase, providing necessary care, pain management, and guidance on post-surgical activities to promote a smooth and successful recovery. The operating room, often referred to as the OR, is a specially designed and sterile environment where surgical procedures take place. Equipped with advanced medical technology, the operating room provides surgeons with the necessary tools and resources to perform surgeries safely and efficiently. On the other hand, we have the recovery room. This is the designated space where patients awaken from the effects of anesthesia after surgery. In this area, medical professionals closely monitor patients as they regain consciousness, ensuring a smooth transition from the surgical environment and addressing any immediate post-operative needs. Informed consent is a formal agreement given by the patient after understanding the details, risks, and benefits of a proposed surgical procedure. It is a crucial ethical and legal aspect of medical practice, ensuring that patients are well informed and actively participate in decisions regarding their healthcare. Our next term is hemostasis. This is the physiological process of stopping bleeding or controlling bleeding flow during surgery. Surgeons employ various techniques such as sutures, cauterization, and the use of hemostatic agents to achieve hemostasis and prevent excessive bleeding, promoting a safe and successful surgical outcome. Now it's time to take the vocabulary we've just learned and make some really great English phrases for them. I'll say each sentence twice and give you a chance to say it after me. Don't worry if you fall behind, just press pause. Let's start with our first phrase. I understand the risks and give my informed consent for the surgery. Listen to the sentence again and then repeat after me. I understand the risks and give my informed consent for the surgery. Okay, let's move on to our next sentence. The anesthesiologist will discuss the type of anesthesia you'll receive. The anesthesiologist will discuss the type of anesthesia you'll receive. The surgeon will make an incision in this area. Repeat after me. The surgeon will make an incision in this area. Our next sentence is, the operation will take place in the operating room. The operation will take place in the operating room. You'll be under general anesthesia during the surgery. You'll be under general anesthesia during the surgery. Please prepare the patient for surgery in the preoperative area. Please prepare the patient for surgery in the preoperative area. The incision site will be cleaned and sterilized before the procedure. Repeat after me. The incision site will be cleaned and sterilized before the procedure. The nurse will assist in suturing the wound post-surgery. The nurse will assist in suturing the wound post-surgery. The recovery room is where you'll wake up after the operation. Repeat after me. The recovery room is where you'll wake up after the operation. The surgeon will ensure proper hemostasis to control bleeding during the procedure. The surgeon will ensure proper hemostasis to control bleeding during the procedure. And that wraps up our English vocabulary lesson on surgery. Today we're delving into the dynamic field of emergency medicine. Whether you're a healthcare professional, a student, or simply interested in expanding your English vocabulary, you're in for an informative ride. And we're going to start with the topic of today's lesson, emergency medicine. This is a medical speciality focused on the prompt assessment, diagnosis, and treatment of acute illnesses and injuries. Emergency physicians work in emergency departments to provide immediate care and stabilize patients in critical conditions. Our next term is triage. Repeat after me. Triage. Triage is the process of quickly assessing and prioritizing patients based on the severity of their condition. It ensures that those with the most urgent needs receive immediate attention. Triage. Trauma refers to physical injuries resulting from accidents, falls, or violence. Emergency medicine often deals with trauma cases that require rapid intervention. Repeat after me. Trauma. Resuscitation involves efforts to revive or restore normal bodily functions in a patient experiencing cardiac arrest, respiratory failure, or other life-threatening emergencies. Resuscitation. Related to the term resuscitation, we have defibrillation. This is the delivery of an electric shock to the heart to restore its normal rhythm. Automated external defibrillators, or AEDs, are commonly used in emergency situations. Defibrillation. We also have cardiopulmonary resuscitation, often called CPR. This is a life-saving technique that combines chest compressions and rescue breaths to maintain blood circulation and oxygenation in a person whose heart has stopped. Intubation involves inserting a tube into the airway to assist or secure the passage of air into the lungs. It is often performed in cases of respiratory distress. Repeat after me. Intubation. Our next term is epinephrine. Repeat after me. Epinephrine. This can also be known as adrenaline. It is a hormone and medication used in emergency situations to treat severe allergic reactions, also known as anaphylaxis, and cardiac arrest. Let's try it one more time. Epinephrine. Intravenous therapy, or IV therapy for short, involves giving fluids, medications, or blood products directly into a patient's veins, ensuring rapid absorption in emergency situations. So we have intravenous therapy, or the abbreviation is IV therapy. In the context of emergency medicine, shock is a life-threatening condition where insufficient blood flow to vital organs leads to cellular and organ dysfunction. Prompt intervention is crucial to prevent further complications. Shock. Our next term is hemorrhage. A hemorrhage is excessive bleeding, and controlling it is a critical aspect of emergency medical care. Techniques like direct pressure and tourniquets may be used. Repeat after me. Hemorrhage. A fracture is a break or crack in a bone. Emergency medicine addresses fractures with assessments, immobilization, and referral to specialized care. Fracture. Our next term is naloxone. This is a medication used to rapidly reverse opioid overdose by binding to opioid receptors, restoring normal respiration. Naloxone. Let's move on to seizure. A seizure is a sudden, uncontrolled electrical disturbance in the brain. A seizure can sometimes be referred to as a fit. This condition is supported with emergency medicine with medications and supportive care. Seizure. Decontamination involves the removal or neutralization of harmful substances from a person. This is often necessary in cases of chemical exposure or contamination. Decontamination. Thank you so much for joining me for this brief overview of emergency medicine vocabulary. I hope you found this lesson informative and valuable. Feel free to like, share, and comment with any questions or suggestions for future lessons. Hello and welcome to Learning English Pro. In this video, I'm going to delve into a word list that will equip you with essential medical vocabulary related to diseases and disorders. The first word on our list is asthma. Asthma is a chronic respiratory condition that causes difficulty in breathing due to narrowed airways and increased mucus production. Next up, we have hypertension. Hypertension, also known as high blood pressure, is a condition where the force of blood against artery walls is consistently too high, increasing the risk of heart disease and stroke. Moving on, let's talk about diabetes. Diabetes is a metabolic disorder characterized by high blood sugar levels, often resulting from the body's inability to produce or use insulin effectively. Arthritis is another term on our list. It's used to describe various inflammatory joint diseases that cause pain, stiffness, and swelling. Now let's learn about influenza, or the flu. Influenza is a contagious respiratory illness caused by influenza viruses, presenting symptoms like fever, cough, and body aches. Next word is depression. Depression is a mental health disorder characterized by persistent sadness, loss of interest, and lack of energy. Alzheimer's disease is a progressive neurological disorder that affects memory and cognitive functions, primarily occurring in older individuals. Cancer refers to a group of diseases characterized by the uncontrolled growth and spread of abnormal cells in the body. Another term is obsessive-compulsive disorder, or OCD. OCD is a mental health condition where individuals experience recurring unwanted thoughts and engage in repetitive behaviors to alleviate anxiety. Now let's understand epilepsy. Epilepsy is a neurological disorder that causes recurrent seizures due to abnormal brain activity. Pneumonia is a serious respiratory infection that inflames the air sacs in one or both lungs, leading to coughing, fever, and difficulty breathing. Next, we have anemia. Anemia is a condition characterized by a deficiency of red blood cells, or hemoglobin, resulting in fatigue and weakness. A migraine is a severe headache accompanied by sensitivity to light and sound. Rheumatoid arthritis is an autoimmune disease that primarily affects the joints, causing inflammation and pain. Hepatitis refers to the inflammation of the liver, which can be caused by viral infections, alcohol, or certain medications. Atherosclerosis is a condition where plaque builds up inside the arteries, restricting blood flow and increasing the risk of heart attacks and strokes. Schizophrenia is a mental disorder characterized by delusions, hallucinations, and disordered thinking and behavior. Osteoporosis is a condition where bones become weak and brittle, increasing the risk of fractures. Fibromyalgia is a chronic pain condition characterized by widespread musculoskeletal pain, fatigue, and tenderness in specific areas. Lastly, let's explore gastritis. Gastritis is the inflammation of the stomach lining, often causing stomach pain, nausea, and indigestion. And there you have it, a comprehensive word list of diseases and disorders. Hello everyone, welcome back to Learning English Pro. I'm Jer, your online tutor and guide. Today we're delving into the captivating world of psychology, exploring essential psychological terms. Whether you're a psychology student or just curious about the human mind, this video is for you. So let's get started with our first term, which is the topic of our lesson, psychology. Psychology is the scientific study of the human mind and behavior. It seeks to understand and explain our thoughts, feelings, and actions. Psychology. Next up, we have the word behavior, which has different spellings in American and British English. Behavior encompasses all actions and reactions of an individual or organism, from simple reflexes to complex interactions. Behavior. Now let's explore cognition. Cognition refers to mental processes such as perception, thinking, reasoning, and problem solving. Repeat after me. Cognition. Emotion is our next term. Emotions are complex psychological and physiological responses to events or situations involving feelings like joy, fear, anger, and more. Emotion. Moving on to memory. Memory is the ability to store, retain, and recall information and experiences. Memory. Consciousness is the awareness of one's thoughts, feelings, and surroundings at any given moment. Consciousness. Next, we have perception. Perception is the process of interpreting sensory information to understand and make sense of the world. Perception. Stress is a psychological and physiological response to challenging situations, often leading to feelings of tension or anxiety. Stress. Now, motivation. Motivation is the internal or external drive that initiates, directs, and sustains behavior towards a goal. Motivation. Personality is a unique set of enduring characteristics, behaviors, and traits that define an individual. Personality. Moving on to intelligence. Intelligence is the capacity to learn, reason, and solve problems effectively. Intelligence. Our next term is abnormal psychology. This is the study of atypical behaviors and psychological disorders, aiming to understand and treat them. Abnormal psychology. Therapy refers to the various treatments and interventions used by psychologists and mental health professionals to help individuals improve their psychological well-being. Therapy. Our next term is social psychology. This focuses on how individuals are influenced by social interactions and the impacts of groups on behavior and attitudes. Social psychology. We also have developmental psychology. This type of psychology examines the psychological growth and changes that happen from infancy to old age. Developmental psychology. The word I've already mentioned is anxiety. Anxiety is a state of uneasiness or worry, often accompanied by physical symptoms such as increased heart rate and restlessness. Repeat after me. Anxiety. Depression is a mood disorder characterized by persistent sadness and a loss of interest or pleasure in activities. Depression. The term self-esteem means an individual's overall evaluation of their self-worth and self-perception. Self-esteem. Schizophrenia is a severe mental disorder characterized by disorganized thinking, hallucinations, and a loss of contact with reality. Repeat after me. Schizophrenia. Psychotherapy is a form of treatment involving psychological techniques and talking to a trained therapist to address emotional and mental health issues. Psychotherapy. Understanding these psychological terms is a window into the fascinating world of psychology. Hello, you're very welcome to this English vocabulary lesson on doctors. Our first type of doctor is a general practitioner. Now this is the British English, general practitioner. It can also be shortened to just GP. GP. Now, this might be more commonly known as a family doctor or your local doctor. In American English, it is commonly referred to as a medical doctor. And this role can also be referred to in American English as a physician. So let's move on and have a look at some additional information and context for a physician or a GP. The area of medicine they work in is known as general medicine. And did you know the earliest documentation for a formal hospital with physicians that treated patients comes from the 5th century BC in Sri Lanka? Hippocrates, who lived from 460 to 377 BC, is commonly called the father of medicine. He is thought to be one of the first physicians to treat disease as being a result of natural rather than supernatural causes. And because of him, we have the Hippocratic Oath, which is an oath of ethics historically taken by physicians. In its original form, it requires a new physician to swear to uphold specific ethical standards. Okay, it's time to move on to our next type of doctor, which is a pediatrician. Repeat after me. Pediatrician. So what does a pediatrician do? A pediatrician is a medical doctor who manages overall health for children from birth until age 18. And the area of medicine is called pediatric medicine. And the very first pediatric hospital was opened in Paris, France in 1802. Let's move on to our next type of doctor, a neurologist. Repeat after me. Neurologist. Neurologists are specialists who treat diseases of the brain and spinal cord, peripheral nerves, and muscles. And the field that a neurologist works in is called neurology. Neurologists treat serious conditions like stroke, Alzheimer's disease, and multiple sclerosis. Our next doctor type is a dermatologist. Repeat after me. Dermatologist. And of course, a dermatologist works in the area of dermatology. A dermatologist is a doctor who specializes in conditions involving the skin, hair, and nails. A dermatologist can identify and treat more than 3,000 conditions. These conditions include eczema, psoriasis, and skin cancer, among many others. Next up, we have anesthesiologist. This one's quite tricky. Anesthesiologist. Let's try it one more time. Anesthesiologist. An anesthesiologist works in the area of anesthetics. This provides treatments such as anesthesia, intensive care medicine, critical emergency medicine, and pain medicine. Anesthesia is a state of controlled temporary loss of sensation or awareness that is induced for medical purposes. Our next medical doctor is a dentist. Repeat after me. Dentist. A dentist works in the area of dentistry. A dentist, also known as a dental surgeon, is a surgeon who specializes in dentistry, the diagnosis, prevention and treatment of diseases and conditions of the mouth. Have you ever thought about who the first dentist was? Ra is the earliest dentist whose name is known to us. Around 2600 BC in ancient Egypt, he was known as the chief of dentists. Our next doctor type is an oncologist. Repeat after me. Oncologist. An oncologist works in the area of oncology, but this is more commonly known as cancer treatment. These are doctors who treat cancer and provide medical care for a person diagnosed with cancer. In the area of oncology, there are three major areas: medical, surgical, and radiation. An oncologist treats cancer using chemotherapy or other medications, such as immunotherapy. Let's move on to our next doctor type, a surgeon. Repeat after me. Surgeon. A surgeon works in the area of surgery. And surgery is used to investigate or treat conditions such as disease or injury, to help improve bodily function, appearance, or to repair unwanted ruptured areas. If we look back in history, surgery in different forms has been performed by humans for thousands of years. The earliest evidence comes from over 8,500 years ago. Let's move on to our next doctor, which is a cardiologist. Repeat after me. Cardiologist. A cardiologist works in the area of cardiology, and they are doctors who diagnose, assess, and treat patients with diseases and defects of the heart and blood vessels. Let's take a moment to talk about the human heart. The average heart is the size of a fist in an adult. Your heart will beat about 115,000 times each day. It also pumps about 2,000 gallons of blood every day as well. Our next type of doctor is a radiologist. Repeat after me. Radiologist. A radiologist works in the area of radiology, and they are medical doctors that specialize in diagnosing and treating injuries and diseases using medical imaging procedures. Let's take a look at the types of imaging procedures. There are X-rays, computed tomography, which is also called a CT scan, magnetic resonance imaging, also called an MRI, positron emission tomography, PET, or an ultrasound. Let's move on to our final doctor of this lesson, a psychiatrist. Repeat after me. Psychiatrist. These doctors work in the area called psychiatry. A psychiatrist can diagnose and prescribe medication to treat a variety of complex mental illnesses, such as depression and bipolar disorder. In the area of psychiatry, a founding father of this medical field is Sigmund Freud. He was an Austrian neurologist and the founder of psychoanalysis, a clinical method for treating psychopathology through dialogue between a patient and a psychoanalyst. And with Freud, that brings us to the end of our English lesson on types of doctors. How did it go for you? I hope you really enjoyed it, and thank you for visiting my channel. I really appreciate your support. Greetings everyone, and a warm welcome back to Learning English Pro. Today we're delving into a captivating topic that bridges languages and cultures: nursing roles. Okay, let's get right to it. Our first role is a registered nurse, or abbreviated to RN in the United States, or a registered general nurse in the UK, an RGN. This type of nurse provides direct patient care, administers medications, monitors patients' conditions, and collaborates with doctors to plan and implement treatment. Next up, we have a licensed practical nurse, an LPN, in US English. In UK English, it's called an enrolled nurse, or an EN. This type of nurse assists with patient care, performs basic medical tasks, and monitors patients' vital signs under the supervision of RNs or doctors. A certified nursing assistant, a CNA in US English, or a nursing auxiliary in UK English, provides hands-on care to patients, assisting with activities of daily living such as bathing, feeding, and dressing. A clinical nurse specialist in American English, or advanced nurse practitioner in UK English. These are advanced practice nurses who specialize in a specific care, like pediatrics or critical care, and they provide expertise in patient care, education, and research. In American English, our next role is referred to as a nurse practitioner. In British English, it's called a nurse prescriber. These are advanced practice nurses who can diagnose and treat medical conditions, order tests, and prescribe medications, often working independently. A certified registered nurse anaesthetist in American English, or simply a nurse anaesthetist in UK English, administer anesthesia to patients who are undergoing surgery, ensuring their comfort and safety during procedures. A certified nurse midwife in the US is simply called a midwife in UK English. They provide care to pregnant women before, during, and after childbirth, offering a holistic approach to maternity care. A pediatric nurse in American English is called a children's nurse in UK English. These nurses specialize in caring for infants, children, and adolescents, addressing their unique medical and emotional needs. A neonatal nurse is a term used in both US and UK English. These refer to nurses who care for newborns, particularly those born prematurely or with medical complications. And this is usually done in neonatal intensive care units. An oncology nurse in the US may be called a cancer nurse in the UK. These types of nurses specialize in caring for patients with cancer, providing support, administering treatments, and managing side effects. An emergency room nurse is a general term, and this relates to nurses who work in the fast-paced environment of the emergency room. Their work involves assessing and treating patients with various medical emergencies. Our next term is intensive care unit nurse. Intensive care unit is usually abbreviated to ICU, so this nurse is typically called an ICU nurse. And they care for critically ill patients, monitoring their conditions and administering specialized treatments in intensive care settings. Let's move on to the operating room nurse. These nurses assist surgeons during surgical procedures, ensuring that the operating room environment is sterile and safe. A psychiatric nurse specializes in mental health care, providing support, therapy, and medications to patients with psychiatric disorders. Let's move on to geriatric nurse. Geriatric nurses care for elderly patients, addressing their unique health needs and promoting quality of life in aging populations. A rehabilitation nurse works with patients recovering from injuries or surgeries, helping them regain mobility and their independence. Our next nurse role is the community health nurse. Community health nurses provide care and education to individuals and families within communities, focusing on preventative care and health promotion. School nurses care for students' health and well-being, managing medical needs and promoting a healthy school environment. A hospice nurse or a palliative care nurse provide compassionate care to those who are terminally ill and their families, focusing on comfort and quality of life. And last but not least is the travel nurse. Travel nurses work on short-term assignments in various healthcare settings, often moving between hospitals or regions to address staffing needs. In this video, we're taking a look at medical professions beyond doctors and nurses. So if you're ready, let's embark on this journey together. And first up, we have the speech-language pathologist. These are experts in communication and swallowing disorders. They assess, diagnose, and provide therapy to restore effective communication. Speech-language pathologists work with children and adults, helping those with speech, language, voice, and fluency disorders regain their ability to communicate effectively. Next up, we have occupational therapists. They are dedicated to helping individuals regain and improve their abilities to perform daily life activities. Occupational therapists work with patients of all ages who, due to physical, mental, or developmental conditions, need assistance in learning new ways to perform day-to-day activities. Physical therapists specialize in diagnosing and treating injuries and conditions affecting a person's physical movement and function. They use various therapies, exercises, and techniques to aid recovery. Physical therapists design personalized treatment plans for patients, targeting pain relief, improved mobility, and the restoration of function. Our next profession is a radiologic technologist. This medical professional is responsible for performing various medical imaging procedures such as X-rays and MRIs, ensuring the accurate capture of diagnostic images. They play an important role in diagnostic imaging, working closely with patients and physicians to capture high-quality images essential for medical diagnosis and treatment planning. Respiratory therapists specialize in the care of individuals with breathing and cardiopulmonary disorders. They provide critical treatments, therapies, and diagnostic testing to ensure optimal respiratory health. Respiratory therapists work with patients of all ages, from premature infants with underdeveloped lungs to elderly individuals with chronic respiratory conditions. Medical laboratory technicians are the unseen heroes of healthcare, conducting essential tests on patient samples to assist in disease diagnosis and monitoring. Pharmacists are medication experts, ensuring the safe and effective use of prescription and over-the-counter drugs. They provide medication counseling, oversee drug dispensing, and collaborate with healthcare providers to optimize patient medication regimes. Physician assistants practice medicine under physician supervision. They diagnose, treat, and manage various medical conditions, offering a wide range of healthcare services. Dental hygienists specialize in oral health, providing preventative dental care, cleaning teeth, and educating patients on proper oral hygiene practices. They work closely with dentists to ensure optimal oral health and often perform teeth cleanings, oral examinations, and education on maintaining healthy teeth and gums. An optometrist is an eye care specialist who will examine, diagnose, and treat vision problems and eye diseases. They prescribe corrective lenses such as eyeglasses and contact lenses and provide comprehensive vision care services. Optometrists also detect and manage various eye conditions, contributing to overall eye health. Chiropractors specialize in musculoskeletal health, emphasizing manual adjustments to the spine and other parts of the body to relieve pain and improve function. Chiropractors use non-invasive techniques to treat conditions such as back pain, neck pain, and other musculoskeletal issues, often without the need for surgery or medication. Our next professional role is a nutritionist, which can also be known as a dietitian. These are experts in food and nutrition, helping individuals make healthy food choices, manage dietary restrictions, and address nutritional needs. They work in various settings, including healthcare facilities, schools, and private practice, offering personalized nutrition guidance and education. Clinical psychologists provide therapy and counseling for individuals dealing with mental health issues and emotional well-being, helping patients overcome challenges and improve their mental health. Clinical psychologists use evidence-based approaches to diagnose and treat various psychological conditions, supporting patients on their journey to mental well-being. Medical social workers offer vital support to patients and families, helping them cope with medical conditions and navigate the healthcare system. They provide emotional support, connect patients with necessary resources, and ensure that patients' psychosocial needs are addressed throughout their medical journey. A paramedic, or an EMT stands for Emergency Medical Technicians, are the first responders, delivering emergency medical care and transportation to individuals facing injuries or acute medical conditions. They provide immediate medical intervention, including administering medications, performing life-saving procedures, and transporting patients to medical facilities for further care. An audiologist is a medical professional who specializes in hearing and balance disorders, providing diagnostic evaluations and treatments for patients of all ages. They help individuals with hearing impairments by offering solutions such as hearing aids and assistive listening devices. Prosthetists design, fit, and fabricate prosthetic limbs and braces to help individuals regain mobility and functionality. They work closely with patients to customize and provide these devices, offering improved quality of life. Medical illustrators combine their artistic skills with medical knowledge to create detailed illustrations and visual aids used in medical textbooks, patient education materials, and presentations. They play a crucial role in simplifying complex medical concepts for various audiences. Medical librarians manage and organize medical information and research resources in healthcare settings. They assist healthcare professionals in finding the latest medical literature and research, supporting evidence-based practice. Medical dosimetrists work in radiation oncology, calculating radiation doses and treatment plans for patients undergoing radiation therapy. They collaborate with radiation oncologists and medical physicists to ensure the safe and effective delivery of this treatment. All of the professionals we've covered in today's video are the unsung heroes of healthcare, working tirelessly to ensure the well-being of patients. If you found this video informative, please hit the like button and subscribe for more educational content.